hundreds of thousands of people are working themselves to death every year. That's according to research by the World Health Organization, which shows the harm that long working hours can inflict on people's well-being. The health body has warned that global work-life balance may have gotten worse due to the coronavirus pandemic. Paolo Montecillo has more.
Working longer hours at the office may help you climb the corporate ladder. But a new global study shows it could put you on a slippery slope to an early grave.
We found working 55 or more hours per week increased risk of dying of ischemic heart disease by 17% after 10 years. We also found working 55 hours or more per week increased the risk of having a stroke by 35%.
Professor Jian Li helped put together the World Health Organization's first study on long working hours. It links those long hours to 745,000 deaths in 2016. That toll is 30% higher than at the start of the century. The study looked into numbers from 194 countries and found the problem was particularly bad in Australia, China, and Japan. And matters may have gotten worse during the pandemic.
We have some evidence that shows that when countries go into national lockdown, the numbers of hours work increased by about 10%.
The WHO says work-from-home arrangements have made it harder for employees to disconnect. Shaky job markets also tend to make people who've managed to stay employed work even harder. And that extra effort may be pointless.
If we work really long hours, we're more stressed and we're less likely to be as productive as we would be if we work healthy hours. So it's really a smart choice to not increase long working hours during an economic crisis and rebuild better.
The WHO is recommending that employers cap hours to around 40 a week. It says people who are healthier and less stressed will work best. Paolo Montecillo, TRT World.
Let's get more on the report from Frank Pega in Geneva. He's a technical officer at the World Health Organization's Environment, Climate Change and Health Department. He says the effects of long working hours cut across all sectors, though some people are more vulnerable than others.
We did a number of analyses to see if we could find in the data differences by occupation or by industrial sector. And indeed, there was no information to that end. We found that the risks seem to be increased equally across all occupational and industrial sectors. From our data, we can see that everybody who works long working hours across sectors, across sexes, across regions, there was no indication in the evidence that there were differences. What we did find, though, when we crunched the numbers and we provided the estimates themselves, that there's a disproportionately large burden in the end carried by males. So 72%, for example, of all death attributable to long working hours occur amongst males. And we also had disproportionately many people die in the Western Pacific region and in Southeast Asia. And this might be, if you ask yourself why that is the case, this might be due to a large proportion of the workforce being in the informal economy, where people might be having to work long hours in order to survive.